Good morning, and I appreciate everyone coming here today to talk about what's going on today in the life of our new life. And, what's going on around Albany County in the Capital District. But I do want to start off by saying I've been talking to my counterparts. We talk every night. I was talking to Steve Newhouse down in Orange County. Some of the stuff going on down there, the major outbreaks they're having because they're up to almost 1,000. And to Mark Marinello down in Dutchess, Mary Ellen Odell down in Putnam, and George Latimer, and Steve McLaughlin, who's been a great partner going back and forth, sharing ideas and different things we can do to move forward. These are challenging times we're in, and it's just not Albany County facing this. This is all of New York facing this, and that's the point that I'm making. I talked to Tony Presenti going out west as this is affecting all the state, and the time now is to come together and to say to people, and I said this a couple days ago, and I think Liza and I feel like we're robots saying the same stuff. Wake up, people. I said it 3 days ago. Wake up. It's here. Just because you're home and you're not working doesn't mean you're free to go out and do anything you want to do. The other day the traffic was light. There wasn't people out. And then yesterday I'm like, is anyone understanding this? Social distancing. Staying away from people, staying home. That's why I brought it up the other day. Care about 3 people in your life and keep it in your pocket. And if you don't, and you only care about yourself, then write your own name in your own pocket, and and just realize that the more you protect yourself, you're gonna protect your own self, but you're helping out other people. I told you yesterday we had the issue about people not wanting to stay home and confined, not understanding the magnitude of the seriousness of the situation the state's in. If you look at what's going on down in New York City, I was watching the news down there, seeing what's going on, talking to some of my counterparts down in the city, and not only are they short on PPE, their numbers are going through the roof. And that's why I said this when we started down this journey, that this is just the beginning. We're not at the tip of the spear. And I say tip of the spear, it's like a military terminology, and I do want to apologize because people are like, what do you mean? We're not there. But in the next week or two, we're going to be there, and you're going to see more cases. Now, unfortunately, it gets back to one of the things that Liza and I have been discussing in trying to make it happen to get testing back. Our numbers today, it went up to 178, and 178 people. And we have 539 people under mandatory quarantine, 234 people under precautionary quarantine, and there are now 13 people being hospitalized at the rate of 7.3%, and all those have tested positive. It's the reason why I keep showing the graph, and it would be much higher than this. Our number would be much higher than this, but our testing came to a standstill. And the numbers you're starting to see now are primarily hospital workers that are in the hospital, our front line of defense. And I do want to say to the men and women, the police officers, the firefighters, the EMS responders, our Department of Health, all the workers down there that are doing a great job, and especially our hospital staff and everyone there in the trenches, thank you. But you'll see them numbers that are going up, and Liza will talk about that. It's more in the hospital settings now because it's getting harder to test. When we look at everything, and as we continue to go forward down this path, we can be in this as great partners working together, and that's what I want to see. That's what I love about Albany County. We do come together, and I want you to pay attention, people, to what's going on social media in other counties. People handle things differently, and that's why automatically, day 2, I set up the mental health line, and Dr. G will talk about the success after we launched it, and then when he was here 2 days ago. That's why I did it. Don't be afraid to pick up the phone. Times are changed. Things are differently. Don't be afraid to ask a question. You're not in this alone. Trust me. The questions and feelings you have, everyone's feeling it. And as things start to get real, like they have in Italy, and they're going to continue in New York City, and we're in the direction that it's going, people are going to feel different. And you're going to see the new world. And when you see what's going on, we can get through it, but we'll get through it together. I just talked to Mayor Sheen, and we were talking about the other day about parks being closed and what can you do. And she really was trying to leave the parks open to give people an opportunity to go there and play basketball maybe by themselves, or be responsible. You know, hoping that everyone here in the city would do the right thing. But obviously, you saw yesterday, basketball courts were full. People were playing basketball. People were at the skateboard. Everyone wasn't paying attention to social, you know, the 6 feet separation and, you know, basically washing your hands and doing the right thing. Because again, I keep saying, wake up, Albany County, wake up. It's here. It's all over. It's all over. And the more you follow these protocols, the better off you'll be. So I believe she's going to be doing things to corner off the parks and the basketball courts to keep people off of them now. It's the same thing we tell people: go out, go get some fresh air, go take a walk, discover Thatcher Park. There's a lot of great trails around here that you can take to get away from everything, to get your mind off of everything. But we're monitoring social distancing in public places, and that's not going to change. You know, the governor enhanced the Matilda law to protect New Yorkers most vulnerable over the age of 70. So I do want to thank my mother-in-law and my mother that are well over 70 for staying home and paying attention. It was for underlying illnesses that really hit this population different than anyone else. So please, heed to the protocols. You can stay home. You can do a lot of stuff, arts and crafts. You can go back knitting, whatever, you know. Play games online, whatever you want to do, but stay home, please. That age group, please, please stay home. I saw a Price Chopper out by my house, and I couldn't believe the amount of seniors that were out, and they weren't paying attention. And, you know, listen, we're hoping that the supermarkets, and we need them open, they're essential, start doing more social distancing and allowing limited numbers into their establishments, because they're getting a little crowded. You have to, there's a reason we keep saying it, and I know I sound like a broken record, but you know, we have to continue to say that and put that message out. I want to thank Deborah Tano, our commissioner from Aging, who's been setting up and coordinating home delivery of meals for the population that need it. We have identified them, and also we set up yesterday with 211, as well as you can call there with price gouging. We are still watching price gouging. The district attorney and sheriff are on top of that through 911 in complaints they're receiving at their thing. But so the reverse 211, people will be able to call if you're over the age of 60, and they'll direct you to one of the numbers of those quarantine can be connected for those outside for who need groceries. So if you're under quarantine or mandatory quarantine or precautionary quarantine, we're going to be reaching out to you and making sure you have your groceries and whatever you need, and we will deliver it. And especially people over the age of 60 who qualify, we're going to work with the local food pantries and everyone else in New York Connects to make sure we get you the meals that you need to stay home, and that's what we want you to do. So I'm saying to the seniors out there, we will get the food to you. There's plenty of people out there doing that, but we're going to continue to do it. That's one of the initiatives that we'll be launching with the National Guard on Monday about getting the food out to the people that we shouldn't be out and shouldn't be going out. And I want to thank the CEO of the United Way, Peter Gannon, for everything on that and everything he's helping us out with, and in the Regional Food Bank of Northeastern for your help. Can't thank you enough. Like I said, on Monday we'll be doing the box lunches and box food to be delivered to different people. And also I want to say to the small businesses. So we've been working with the small businesses to show them how they can go to a website, apply for help. There's a website up there. Please go to that, and you can try to get some relief under the stuff that's been passing the funds through. I want to thank Senator Schumer's office, Congressman Tonko's office, for reaching out to us to make sure that this is established and making sure that people here, not just in Albany County, but in the Capital Region, get the help that they need to get them through this difficult time. Like I've said and will continue to say, we need to work together to get through this. Times have changed. We need to take a step back, a deep breath, and we're going to get through this. We're going to get through this, but cooler heads will prevail. And just remember, everyone's feeling the anxiety, everyone's feeling differently, and as you see more and more of this go up, it's going to change even more. I'm hoping by tomorrow with Dr. Whalen, either tomorrow or Monday, and I'm hoping Tuesday the latest, that we will have everything in place to bring up testing, but there's going to be different protocols. It's not, we're not going to be able to just test anyone that wants to go through, but we'll be coordinating that effort through the hospitals and doctors' offices. So there's going to be protocols. We're going to make that clear that you're not just going to be able to drive up and say you want to be tested, but we will get that test up and running so the health department can continue to do the great job that the men and women are doing down there, mapping and tracking and trying to stop the spread. But Dr. Whalen.
Thanks, County Executive McCoy. So if we could just go back to the curve again. We talked last week about what this would start to look like without widespread community testing, and today we start to see the result of that. It almost looks like we're leveling off. As we are limited in our testing capabilities, we are not able to capture the true amount of COVID-19 that's in our community, and this is what we're seeing on the graph. However, we're hearing from our healthcare workers, from our providers, and from others in the community that this is increasing in our community. I think one thing that makes it difficult not to have this testing is to really not be able to represent this to the community. We're talking about something that's invisible. It's a virus. You can't see it. You can't feel it until it affects you. So we are warning people about something that's very difficult for them to appreciate until it comes to them. We advise people to look at the news. We advise people to look at where this has affected other places. But we live in a culture of 24/7 news cycle, and people are used to seeing disasters play out across the world, and it often doesn't feel real until it hits home. This is unprecedented. This is different than anything we have ever seen before. And again, I encourage people not to wait until this hits you, not to wait until this hits someone in your family to start following the advice that we're providing people with, the advice that's being given to every citizen of this country. And it is more important for those that live in New York State right now to follow this, to keep themselves safe, to stay at home, to keep up social distancing, to assist those around you that may be in a higher risk group. So if you are out getting groceries, perhaps you could see if there are those in your neighborhood or those in your family that are over 60 that might need you to pick up a few things for them that you could leave on their front porch. It's time to pull together. I heard the Prime Minister of New Zealand say to the people of New Zealand, for those that are concerned that you don't have a job, you do have a job. Your job is to stay home. I would say to everyone that this is a responsibility right now. What you are doing, despite the boredom, despite the difficulty, despite the stress, is for the greater good. And it is for yourself and your family. So I would encourage people to continue to do this very important work of staying home and keeping distance from others. You are saving lives. You are making a difference. We are starting to hear about concerns related to personal protective equipment in various entities around the area. And we're looking very closely at how we can assist those who are in need. We're working with the hospitals. We're working with the providers. We're working with the community. And we're working with the cases that have been identified to ensure that they are home every day, to ensure that they have their needs met. And I would like to again appreciate County Executive McCoy and all the efforts that he's done to make sure people that are home are getting what they need in their home. And we're working with people that are on quarantine. We contact them on a daily basis. We make sure that they are not experiencing symptoms or fever or a need for a health evaluation. This work is real. So if you're working where I work, if you work where County Executive McCoy works, and if you work where all the providers and many people in the county that currently are working out at a place of employment every day, you're seeing this firsthand. It's difficult to understand that at home, but please take our words for it. It's there, it's occurring, and the need for you to do your part is just as important as the work that we're doing. So please continue to do your part. Thank you.
Thank you, Dr. Whalen. And Dr. Giordano, who's going to talk about the volunteers that we got since the last press conference and what's going on. So, Dr. G.
Good morning. Thank you, County Executive. Some interesting developments since last Thursday's presser. We received a dozen calls from community practitioners who wanted to volunteer and assist us on our mental health support line. We have accepted that, those volunteers. One of them called as far away as from California, who is someone who has ties to the Capital District and somehow has been staying in touch and listening to us and to media reports about what the needs are in Albany County. So we have 12 additional practitioners who we're going to add to our rotation. Right now, our mental health support line is staffed by our emergency disaster mental health team and our mobile crisis team. Adding 12 people to that rotation will allow us to expand the hours, and we're working on the logistics of that. So I'm hoping that by early next week we'll be able to report to you increased hours for that support line. So that was really a thrill to hear from folks in the community who wanted to step up and assist us. So far we've had about 75 calls to the support line, and as you know, it's 8 to 5, 7 days a week, and we've given out the number a number of times. So I would just like to say as well that the reason that the county executives asked me to join you this last 2 times is just to underscore the fact that mental health is important because it impacts your physical health, and your physical health is important in fighting off this virus. So we've talked about this a number of times, but there are things that you could do that can help you stay strong, and we're here to help you in that regard. And also to remind you, if you're one of the if you or one of your loved ones is receiving services from the Albany County Department of Mental Health, just to remind you that we are operational. We are providing services to almost 1,000 people, and we'll continue to do that as best we can.
Thank you, Dr. G. Before I take questions, I especially want to thank again Major General Shields from the New York Army National Guard for his help with the men and women. But one thing sometimes we always say, you have to crawl before you walk, and you have to walk before you run. And I just want people to look at the data and numbers where we're headed. But if you look at Erie County, which is a population over 1 million people, they have 219 cases. We have 178. We're a population roughly of 320,000. If you look at Orange County, that's getting hit hard right now, they have roughly over almost 1,000 cases, and their population's about 375. And Rockland County, who's a little bit the same size as us, is getting crushed right now at 1,457. And I want people to realize, it's like Dr. Whalen said, it's here, it's going on. If we continue testing at the level we were testing for the first week or two, I can assure you our numbers would probably be 400 or 500. And there's a lot of people that are testing positive but have no signs or symptoms, that are carrying it and feel healthy. So that's where the social distancing comes into play. But I do want to thank, and I left Mark Pulling carts out from Erie County and Ed Day and everyone else I've been in contact with, in seeing how they're handling it, because if you're paying attention, it's just coming its way up the Northway, and it's here, but it's going to continue to get a little worse in the next couple of weeks, and we just got to be prepared. And again, I hate to say it, wake up, people, wake up. I don't want you scared. I just want you prepared and ready, mentally and physically, and make sure you keep your families healthy and safe. That's all I want right now.